NCLEX review on neurological system. Let's start with stroke, CVA, cerebrovascular accident. It is a condition that develops when blood rich in oxygen cannot reach brain cells due to either blockage or bleeding. It has two types, ischemic stroke and hemorrhagic stroke. Ischemic stroke is the most common, and there is blood clot within the blood vessels which is caused by thrombosis or embolism. And the hemorrhagic stroke, which is bleeding in the brain or leak in the blood vessels, which is caused by ruptured brain aneurysm, uncontrolled hypertension. And the risk factors are family history, smoking, overweight, physical inactivity, previous TIA, atherosclerosis, blood thinner medications, uncontrolled hypertension, brain aneurysm, etc. The mnemonics of signs and symptoms of stroke is: first, face, arm, speech and time. First of all, we will notice drooling, uneven smile, numbness, weakness, drip, and slurred speech. After noticing this symptom on patient, it is time to call rapid response team, and we need to note the time. In case of stroke, it is important to remember that if patient has right-sided brain damage, there will be left-sided weakness. If patient has left-sided brain damage, there will be right-sided weakness. And the other signs and symptoms are like sudden numbness or weakness, especially on one side of the body, sudden confusion, trouble understanding speech, sudden trouble seeing in one or both eyes, etc. Now let's have some stroke terms: hemiparesis, weakness or partial paralysis on one side of the body; hemiplegia, complete paralysis on one side of the body; TIA, transient ischemic attack, often called as a mini stroke. TIA is a temporary blockage of blood flow to the brain that causes stroke-like symptoms. Aphasia, unable to speak. Dysarthria, hard to understand patient speech. Apraxia, unable to perform voluntary movements. Agraphia, loss of ability to write. Alexia, loss of ability to read. Agnosia, does not understand sensation. Dysphagia, swallowing issues. Hemianopia, limited vision in half of the visual field. Now the nursing interventions for the patient with stroke. First of all, ensure patient airway to provide adequate ventilation. Watch for vital signs. Immediately notify if patient is hypertensive, because hypertension is risk factor for stroke and it will lead another stroke. We need to administer medication as per doctor order, like thrombolytic agents in case of ischemic stroke. With this medication, there is risk of bleeding, so monitor for bleeding, and we also need to assess the PTNR and PETT levels. Being a nurse, watch for change in neurological status like GCS, increase in ICP. After administering medication as per doctor order, after post medication, it is important to prevent other complications like DVT, pulmonary embolism, pressure ulcers. To prevent contractures or to improve circulations, it is important to provide range of motion exercise, frequent repositioning. To prevent from muscle atrophy, it is important for early ambulation as tolerated. In phase of post-stroke, it is important to assess the swallowing ability to prevent from aspiration. Manage patient blood sugar level, because high or low glucose level again will exacerbate the condition like brain injury. Seizure precautions are also important, especially in case of hemorrhagic stroke and the patient who has history of seizure. In post-stroke phase, it is important to provide adequate emotional support and family education. Give patient time to express themselves, never finish their sentence. Instead of use alternative like writing, using pictures, boards. Now let's know the medical management and treatment of stroke. For the ischemic stroke, the tissue plasminogen activator are used like streptokinase, alteplase. This therapy is started within the 3 hours of onset of stroke symptoms. It works by dissolving the clot within the blood vessels by activating the protein that causes fibrinolysis. Endovascular thrombectomy procedure is done in case of large vessel occlusions. Anticoagulant therapy for the conditions which causes blood clot like atrial fibrillation. After TPA, antiplatelet therapy is started to prevent from further clot formation like aspirin. And other supportive managements are blood pressure management, blood sugar management, oxygen therapy. And another surgical procedure in case of hemorrhagic stroke, craniotomy, aneurysm clipping, evacuation of hematoma, reversal of anticoagulants like antagonist of anticoagulants like vitamin K, fresh frozen plasma are also replaced. And we start seizure prophylaxis in case of seizure to improve patient further condition in the post-stroke phase or to provide quality of life to the patient. We provide long-term treatment and rehabilitation therapies like physical, occupational, speech therapies. For the neuropsychological support, we provide adequate emotional support, patient plus family education regarding patient condition and disease condition, and other supportive educations to prevent from further stroke events. Okay, let's go on another topic, that is hydrocephalus. In this condition, there is an accumulation of cerebrospinal fluid within the ventricle of the brain. There are two types of hydrocephalus, communicating hydrocephalus and non-communicating. In the communicating type of hydrocephalus, there is no obstruction of the free flow of the cerebrospinal fluid exists between the ventricles. In the non-communicating type, which is also known as obstructive hydrocephalus, there is obstruction occurs in the free flow of cerebrospinal fluid. The causative factors are like genetic factors, some developmental disorders, spina bifida, neural tube defects, brain injury, trauma, hemorrhage, brain infections like meningitis, brain tumors, poor absorption of cerebrospinal fluid, brain inflammation, disease, overproduction of CSF. Now let's go on clinical manifestations. It is important to know all the manifestation and late manifestations of the hydrocephalus for the NCLEX. Poor feeding, large head, bulging of the anterior fontanelle, settings on eyes, high pitch cry, irritability, lethargy, projectile vomiting are all the signs. While the severe cognitive decline, gait disturbance, urinary incontinence, severe headache, vision problems, coma, unresponsiveness, seizure, bradycardia are the late sign of hydrocephalus. Assessment and monitoring. Neurological assessment is most important, which comes under nursing management for the patient with hydrocephalus. Watch for patient GCS, mental status, or cranial nerve functions. For the infants, monitor head circumference. Monitor patient vital signs. Monitor for change in blood pressure, heart rate, respiratory rate, which may indicate increase in ICP. The bulging fontanelles might be found on infants, so monitor for it. Head elevation should be 15 to 30 degree. Monitor for sign of infection. Assess for drainage. Monitor intake output. Fall prevention, seizure precautions and prevention of infections, patient comfort and pain management is also necessary. Focus on all the identification of complications, patient education about sound care if patient is under ventriculoperitoneal sound. Monitor for sign of increased ICP like headache, vomiting, alter loss of consciousness. Prioritize infection prevention, neurological assessment. Let's go on medical management and treatment. The loop diuretics are used like acetazolamide, furosemide. Anticonvulsants are used to prevent seizure. Antibiotics are used in case of infections. Painkillers are also necessary in case of severe headache. Antiemetics for vomiting because there is projectile vomiting in case of hydrocephalus. And surgery is done in case this hydrocephalus is caused by tumor in the brain. For the cerebrospinal fluid drainage, shunt placement is done. There are three types of shunt, like ventriculoperitoneal shunt, where the shunt is placed from brain to the peritoneal cavity. And another type is ventriculoarterial shunt, where CSF diverted from right atrium to the heart. And in the lumboperitoneal shunt, which diverts the cerebrospinal fluid from the lumbar region of the spine to the peritoneal cavity. And being a nurse, it is important to provide education to the patient and patient party regarding the shunt care and prevention of complication by providing education regarding the sign and symptoms of complications of shunt. Okay, the next topic is spinal cord injury. SCI is a damage to any part of the spinal cord or nerves at the end of the spinal canal. This condition often causes permanent changes in strength, sensation, or other body function below the site of injury. The causes of spinal cord injury are like traumatic events or non-traumatic events, motor vehicle accident, fall injury, violence, sport injury, infections like myelitis, meningitis, spinal abscess, tumors, degenerative disease like spinal stenosis are the region of spinal cord injury. The clinical manifestations depends upon the level of injury. If the injury is at the level of C1 to C8, it will lead quadriplegia. In case of thoracic lumbar spinal cord injury from T1 to L5, it will lead paraplegia plus weakness or loss of movement in the legs, hips, or loss of bowel bladder function. And in case of sacral spinal cord injury, it will lead loss of movement in legs, loss of bowel bladder, and sexual function. Now let's go on nursing management of patient with spinal cord injury. Prioritize on ABC, airway, breathing, and circulation. In case spinal cord injury above the C4 level, it will lead paralysis of the diaphragm and requires mechanical ventilation. The most important part is spinal immobilization and stabilization. We can use cervical collar, backboard, specific spinal stabilization equipment to prevent from further damage. Sometimes it may require surgical intervention for the stabilization of spine. In such case, prepare patient for the operation. And other nursing managements are monitoring vital signs, GCS, mental status, blood pressure, heart rate, oxygen saturation. In case of autonomic dysreflexia, it will lead high blood pressure. The thoracic, lumbar, and sacral region spinal cord injury is closely related to bowel bladder dysfunction. So closely monitor for patient bowel bladder function to prevent from complications like infections and impaction. Urinary catheterization is needed to manage bladder function. And for the bowel management, we can use suppositories, stool softener, digital stimulation. The spinal cord injury can lead significant change in lifestyle or body image, so psychological support is also needed. And provide adequate family education regarding patient care and needs. For the patient rehabilitation, occupational therapy, physical therapy are needed. Other supportive managements are nutritional support, hydration, education, and advocacy. For the medical management and treatment, first of all, we need to ensure the patient airway, breathing, and circulation. Spinal immobilization is the most important. To reduce inflammation and secondary neural damage, we use methylprednisolone within 8 hours of injury. Frequently, neurological monitoring is needed for motor and sensory function. To manage patient pain or to prevent from neuropathic pain, we use analgesics. For the bowel bladder function management, we use catheterization or we use laxative or other suppositories. For the respiratory support, we can use oxygen therapy or mechanical ventilation. In case of autonomic dysreflexia, management of patient blood pressure or management of this condition is most important. Most of the patient with spinal cord injury needed physical occupational therapy and rehabilitation program, and the prevention of secondary injury is important to prevent patient further damage. For the surgical intervention, decompression surgery might be done like laminectomy or laminoplasty. And other surgical interventions are spinal fusion, bone and soft tissue repair, etc. In case of permanent damage to the spinal cord nerve, rehabilitation program and long-term care are needed. The next topic is meningitis. It is inflammation of meninges. Meninges are the protective membranes surrounding brain and spinal cord. And meningitis can be caused by infections, autoimmune disease, or other conditions. Most common causes are viral and bacterial infections. Viral meningitis can be caused by enterovirus, herpes simplex virus, varicella zoster virus, or HIV, etc. Bacterial meningitis can be caused by Streptococcus pneumoniae, Haemophilus influenza type B, and in some conditions, meningitis can be caused by fungal infections. And sometimes Mycobacterium tuberculosis infection can lead infection into the meninges, which is known as tuberculous meningitis. And some other non-infectious meningitis can result from autoimmune disease and drugs like NSAID. And the sign and symptoms are, it is most important part on meningitis. Knowing the sign and symptom, you can guess the condition. Like in this condition, the Corning sign and Brudzinski sign are positive. The other sign and symptoms are headache, fever, neck stiffness, tonsil rigidity, nausea, vomiting, photophobia, increase in ICP, confusion, lethargy, seizure, and coma in severe cases. The another most important part for NCLEX in meningitis is nursing management. We place in droplet isolation for the patient with meningitis. Meningitis leads neck stiffness, so we put patient in neutral position. Frequent neurological assessment is needed. Check for patient level of consciousness, mental status, sign of increased ICP such as restlessness, confusion, vomiting, change in pupils, and we need to monitor for seizure. Regularly monitor for patient vital signs to detect any abnormalities. For the pain management, we need to administer analgesics like acetaminophen and ibuprofen. And other nursing managements are fluid and electrolyte management, nutritional support, We need to promote patient comfort and reduce environmental stimuli, plus family and patient education. Okay, now let's know the treatment of meningitis, which depends upon the causes. In case of bacterial meningitis, we use antibiotic therapy like ceftriaxone, vancomycin are used. In case of viral meningitis, we use antiviral medication like acyclovir. To reduce inflammation, corticosteroids are used like dexamethasone, and other supportive managements are fluid management to maintain hydration and electrolyte balance. For the pain management, we use acetaminophen or brufen. For the fever reduction, we use antipyretics and antiemetics for nausea vomiting. In serious cases, seizure might occur. In such case, we use benzodiazepines or anticonvulsants. To reduce photophobia, provide quiet, dark environment, supportive care and prevention of complications.